G'day everyone, and thanks for tuning in to iHeartHealth. Today, we're diving into a topic that can be a bit sensitive, but it's crucial we talk about it. Diabetes and erectile dysfunction. Now, if you're living with diabetes, you might already know that it can impact your body in various ways. One of these ways, which often gets brushed under the rug, is its potential to affect men's sexual health, specifically erectile dysfunction, or ED for short. We understand that this can be a really tough subject to deal with. It can feel isolating, even a bit embarrassing. But we want to assure you you're not alone. Erectile dysfunction is actually more common than you might think, especially among men who are living with diabetes. So let's break down the barriers and have an open and honest conversation about it. So what exactly is the connection between diabetes and erectile dysfunction? Well, it all comes down to how diabetes affects your blood vessels. You see, diabetes can damage the lining of your blood vessels, making it harder for blood to flow properly. This is particularly problematic when it comes to achieving and maintaining an erection, which relies heavily on good blood circulation. Think of it like this. For an erection to happen, your brain sends signals to the blood vessels in your penis to relax and allow more blood to flow in. However, if those blood vessels are damaged due to diabetes, it becomes difficult for them to respond effectively to the signals. This can lead to difficulties in getting an erection, maintaining one, or both. It's important to remember that the extent of the impact can vary from person to person. Some men may experience mild issues, while others might face more significant challenges. In the next section, we'll delve deeper into how diabetes specifically affects the body and its connection to erectile function. Let's start by understanding diabetes. Diabetes is when your body struggles to regulate blood sugar. It happens when your body doesn't produce enough insulin or can't use it effectively. Insulin is like a key that lets glucose into your cells for energy. Without enough insulin, glucose builds up in your bloodstream. Excess glucose can damage blood vessels, nerves, and organs. Type 2 diabetes is the most common. With proper management, you can reduce diabetes' impact on your health. As we mentioned earlier, diabetes affects erectile function by damaging blood vessels. Imagine your blood vessels as a network of pipes. These pipes need to be clear and flexible. Excess sugar damages the endothelium. This leads to inflammation and plaque buildup. Plaque narrows the blood vessels. Erections need good blood flow. Diabetes narrows and hardens penile blood vessels. This increases the risk of erectile dysfunction. But wait, there's more to the story than just blood vessels. Diabetes can also damage your nerves, a condition known as diabetic neuropathy. This nerve damage can further contribute to erectile dysfunction. Your nervous system is like a complex communication network, sending signals throughout your body. Nerves play a crucial role in transmitting signals from your brain to the muscles in your penis. These signals tell the muscles to relax, allowing blood vessels to expand and fill with blood. When diabetes damages the nerves, these signals can become disrupted. Imagine trying to make a phone call with a bad connection. The message might not get through clearly or at all. Similarly, damaged nerves can interfere with the signals needed to initiate and maintain an erection. Living with diabetes can be challenging enough on its own, but when you add erectile dysfunction, it can take a real toll on your emotional well-being. It's normal to feel frustration, sadness, anxiety, and even a sense of loss. You might feel less confident in various areas of your life. You might withdraw from your partner, fearing intimacy. Remember, you're not alone in this. Reach out for support from your partner, friends, or a healthcare professional. The impact of diabetes and erectile dysfunction often extends beyond the individual, affecting relationships with loved ones, especially romantic partners. Communication can become strained, as both partners might feel unsure how to address the issue. Your partner might feel confused, hurt, or even blame themselves, even though it's not their fault. It's essential to have open and honest conversations with your partner about what you're going through, both physically and emotionally. Share your fears, concerns, and needs with each other. Remember, you're a team, and facing this challenge together can actually strengthen your bond. Encourage your partner to ask questions and express their own feelings as well. Seeking professional guidance from a therapist specializing in sexual health or couples therapy can provide a safe and supportive space to navigate these sensitive conversations and find ways to maintain intimacy and connection. One of the biggest hurdles in addressing the emotional and relational aspects of diabetes and erectile dysfunction is the stigma surrounding these topics. Men, in particular, might feel ashamed or embarrassed to talk about their experiences, even with their doctors. It's important to break down these barriers and encourage open communication. Talking about your feelings and concerns with someone you trust can make a world of difference. Remember, seeking help is a sign of strength, not weakness. Support groups can be incredibly beneficial, providing a safe and non-judgmental space to connect with others who understand what you're going through. Sharing experiences, coping strategies, and words of encouragement can help you feel less alone and more empowered. Remember, you don't have to suffer in silence. Reaching out for help, whether from loved ones or professionals, is a crucial step in managing the emotional and relational impact of diabetes and erectile dysfunction. Now that we've covered the emotional and relational aspects, let's shift our focus to practical management strategies for diabetes and erectile dysfunction. The good news is, there are plenty of things you can do to take charge of your health and improve your quality of life. Think of it like this. Managing these conditions is like having a toolkit filled with different tools. Some tools might work better for you than others, and you might need to use a combination of tools to achieve the best results. The key is to find what works best for you and your individual needs. Don't be afraid to experiment and adjust your approach as needed. Remember, managing chronic conditions is a marathon, not a sprint, and consistency is key. In this section, we'll explore different tools in your toolkit, including lifestyle modifications, medications, therapies, and the importance of seeking professional guidance. Let's dive in. One of the most powerful tools you have at your disposal is making positive lifestyle changes. These changes not only help manage your diabetes, but can also significantly improve erectile function. Let's start with your diet. What you eat plays a crucial role in managing your blood sugar levels and overall health. Aim for a balanced diet rich in fruits, vegetables, whole grains, lean protein, and healthy fats. Think of your plate as a rainbow. The more colourful, the better. These foods provide essential nutrients, fibre, and antioxidants that support healthy blood flow and nerve function. Try to limit processed foods, sugary drinks, and saturated and unhealthy fats, as these can worsen diabetes and contribute to other health problems. Regular physical activity is another crucial tool. Exercise helps your body use insulin more effectively, lowering blood sugar levels and improving blood circulation. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Section 3. Medications and therapies. Exploring your options. In addition to lifestyle changes, several medications and therapies can help manage both diabetes and erectile dysfunction. Your doctor can help determine the best options for you based on your individual needs and medical history. For diabetes management, your doctor might recommend medications that help your body produce more insulin, improve insulin sensitivity, or slow down the absorption of sugar from your food. When it comes to erectile dysfunction, several oral medications, commonly known as PDE5 inhibitors, can help improve blood flow to the penis, making it easier to achieve and maintain an erection. In some cases, your doctor might recommend other therapies, such as penile injections, vacuum erection devices, or even surgery in more severe cases. Don't hesitate to discuss all available options with your doctor to make an informed decision. Remember, medications and therapies can be highly effective, but they work best when combined with healthy lifestyle changes. It's about finding the right balance for your individual needs. Section 4. Seeking professional guidance. Your personalized care plan. Managing diabetes and erectile dysfunction effectively often requires a team effort. Don't hesitate to reach out to your healthcare provider for guidance and support. Your doctor can help you create a personalized care plan that addresses your specific needs and goals. They can monitor your blood sugar levels, adjust your medications as needed, and provide valuable advice on lifestyle modifications. Remember, you're not alone in this journey. Your healthcare team is there to support you every step of the way. By working together, you can effectively manage your diabetes, improve your erectile function, and enjoy a fulfilling and healthy life. Section 1. The power of open communication. We've covered a lot of ground today, from understanding the link between diabetes and erectile dysfunction to exploring various management strategies. But there's one crucial aspect we can't stress enough: the power of open communication with your healthcare providers. It might feel a bit awkward or embarrassing at first to discuss such personal matters, but remember, doctors are there to help. They've likely had these conversations many times before and are equipped to provide you with the best possible care. Don't be afraid to be completely honest about your symptoms, concerns, and any challenges you're facing. The more information you share with your doctor, the better they can understand your individual needs and tailor a treatment plan that works for you. Remember, your health is your priority, and seeking help is a sign of strength, not weakness. So, take a deep breath, gather your thoughts, and schedule that appointment. You'll be glad you did. Managing diabetes and erectile dysfunction often involves a team of healthcare professionals, each with their own expertise. This might seem overwhelming at first, but remember, you're building a support system to help you navigate these conditions effectively. Your general practitioner, or GP, is a great starting point. They can assess your overall health, provide initial guidance, and refer you to specialists if needed. An endocrinologist specializes in diabetes management and can help you regulate your blood sugar levels through medication, lifestyle changes, or a combination of both. A urologist specializes in men's reproductive health and can address any concerns specifically related to erectile dysfunction. They can recommend medications, therapies, or other interventions based on your individual needs. Don't underestimate the importance of mental health care. A therapist or counselor can provide valuable support in coping with the emotional and relational challenges that can accompany diabetes and erectile dysfunction. Managing any chronic condition, especially diabetes and erectile dysfunction, is an ongoing journey, not a one-time fix. There will be ups and downs, times when you feel empowered and in control, and times when it feels overwhelming. Remember, it's okay to not have all the answers, to make mistakes, and to adjust your approach as needed. The most important thing is to keep moving forward, one step at a time. Celebrate your successes, no matter how small they may seem. Don't compare your journey to others, as everyone's experience is unique. Focus on what you can control, your attitude, your choices, and your commitment to taking care of yourself. Remember, you're not alone on this path. With the right support system, a positive mindset, and a commitment to your health, you can live a full and satisfying life, even with diabetes and erectile dysfunction. Well, mates, we've covered a lot of ground today about diabetes and erectile dysfunction. Remember, these are both incredibly common conditions, and there's absolutely no shame in seeking help. We learned that diabetes can affect blood vessels and nerves, which are both crucial for healthy erectile function. But the good news is, there's plenty you can do to take charge of your health. From lifestyle changes like eating a balanced diet and getting regular exercise to exploring medications and therapies, there's a whole toolkit of options available. The key is to find what works best for you with the guidance of your healthcare team. Never underestimate the power of open and honest communication, both with your doctor and your loved ones. Remember, you're not alone in this journey. Living with diabetes, with or without erectile dysfunction can come with its challenges, but it doesn't have to define you. By taking a proactive approach to managing your health, you can significantly reduce the impact of diabetes on your life. Remember to prioritize both your physical and mental well-being. Seek support from loved ones, healthcare professionals, or support groups. Share your experiences, learn from others, and celebrate your successes along the way. Diabetes might throw a few curveballs your way, but with the right knowledge, tools, and support system, you can knock it out of the park. Thanks for watching iHeart Health. Make sure to like, comment, and subscribe for more informative and empowering health content.